Welcome to Research Perch from the Massage Therapy Foundation. Short, practical insights into massage therapy research and how it can benefit your practice.
Hello, everyone. This is Doug Nelson, the president of the Massage Therapy Foundation, and welcome to another episode of Research Perch. In this Perch, what we're going to be exploring are case reports and publishing them in IJTMB, and we have the ideal person to explore that with because I have with me Dr. Blair Kennedy, who is the executive editor of IJTMB and teaches at the University of South Carolina School of Medicine. Thank you for joining us, Dr. Kennedy.
Thank you for having me. I'm going to add one little word there on the end of the School of Medicine to the School of Medicine in Greenville.
Oh,
we
yeah.
also have one in Columbia.
Oh,
so
yeah.
There's actually two campuses, and we actually have two different curriculum. It's very interesting.
Wow.
But anyway,
you're in Greenville, right?
I am in Greenville. And I was also used to be the chair of the case report contest for the foundation. I was the chair for several years. Did you know that?
Very cool. No, I didn't know that. Awesome.
Yeah.
Awesome. Well, speaking of case reports, let's just, I'm going to start there. Maybe we'll take a step back because we're talking about case reports and they're also publishing in IJTMB. Right. Just a little overview of IJTMB for people. Not everybody knows what that's about. So just a little overview. Yeah.
So the International Journal of Therapeutic Massage and Bodywork, or IJTMB, you can find us at ijtmb.org. We are the only open access, fully peer-reviewed scientific journal that does not cost not only for you to access all content, but also does not cost to the authors when they submit and publish with us. So we are completely free. Thank you for the support from the foundation and from the RMTBC for that, because it allows us to keep that in a free space for authors and as well as for the public. So in our journal, we have three separate sections. We have one for research. So that's where you'd see those random control trials. You'd see our cohort and observational studies, maybe some cross-sectional studies. And then we have a section on massage therapy education, and then one on massage therapy practice. So the case reports are published in the practice section because that's what case reports are generally being reported on, is massage therapy practice is usually where that comes in. You'll also see some editorials and you'll see some commentaries in there as well throughout the whole journal, not just in those three sections. But that's how we're set up. We're really trying to explore the different pieces of the business of massage therapy. So looking at those three pieces: research, education, and practice.
Awesome. And when you say open access, for everybody, exactly what that means, what?
So what that means is that you can get to any of our content for free. Oftentimes, if you're interested in research, you might go find an interesting title and go to that journal's website. Maybe you found it on PubMed or someplace else, and it might cost you $35 to just get a copy of it. That would never happen with us. We are completely open access, meaning that nothing is charged to anybody who's wanting to get to any of our content.
Yeah. It is really frustrating when you think, oh, this looks interesting, and then you see for $37.50 you can find out how interesting it is. Like, well, wait a minute, I don't know if I'm $37.50 interested in it, right? So
can I give you a little hint too?
Yeah. Okay.
So if you come across one of those paywalls, it'll oftentimes have a little link that says corresponding author with a little email. Email the author. Ask them if they'll send you a copy. Because they might be able to send you a copy for free.
Okay.
Not all of them will. Not all of them can. But just so you know, just a little hint for our listeners here.
Yeah, you do. I was going to say, you do know I'm recording this, right? So,
I absolutely do. And I always appreciate it when people ask me for the research that I write that might not be open access.
So, and let's talk about case reports specifically. So define just kind of what a case report is.
So when I think of case reports, and when I'm reading them and thinking about them, they are reporting what happens in practice. That's really the simplest way to do it. So for me, when I think about it, what would lead to somebody to why would they want to write a case report? Let's say you have an interesting client or a patient who has either an interesting condition or they had an interesting outcome, positive or negative, based on the treatment that you gave them. And you can write a case report either before you actually provide the treatment or after. So you could have worked with a person and measured their outcomes and write it later, or you can plan it ahead of time and still continue and write it ahead of time. You do have to make sure that you have informed consent from your patient that you're working with. But that's really how it is. It all comes from curiosity with what you're seeing in practice. That's what should bubble it up. Are you working with an individual that came in with something unusual that you hadn't seen before? And you're thinking about how your techniques, what's in your massage therapy toolbox, that's what I remember learning in continuing ed, was, I'm giving you something new to go in your massage therapy toolbox. And this is one of those things, is using your curiosity in practice to be able to inform everybody. And that's what it would be. It would be writing up that curious case and letting the world know about it. And then when you write a case report like that, that can help researchers like me, now that I'm not in practice anymore. But then I can go, oh, they're starting to see this in practice. That's interesting. Maybe I can design a bigger study to help me understand this deeper. Is this just this one or two people that had something work for them? Or does it work for others?
Yeah.
We've had some case reports in the journal on how massage therapy has helped with concussion. I believe we've had some on narcolepsy. There have just been some really interesting stuff. One for someone who was I believe they were a violin player. So dealing with some real...
I remember this.
Yeah, some real positional issues with their craft. Yeah. And how can massage therapy help those individuals work through and be able to keep going with their profession or their hobby or whatever it is, and help them be able to still do it well.
You know, the interesting thing about that is, if indeed this is something interesting that you see in your practice and something that's unusual, if it's unusual to you, it may not be unusual. It may also be unusual to other people, which means if you're looking for research in that, you may have a hard time actually finding a more formalized, larger study about massage therapy and that condition. But if a case report is really about one person with one thing, you're more likely to find that one thing than to find a more formal study, I would assume.
Exactly. So something unusual like that, you might have a case report or a case series, might have a couple of patients or clients with the same condition, you're writing it up similarly. But if you can't find that research, you have somebody come in with narcolepsy. Let's just go with that one, because that one's kind of unusual.
Sure.
How would you treat that person? Are you wanting to provide some massage therapy that might be a little more stimulating? Or are you wanting to slow them down so they'll be able to get more sleep at night? What is the kind of critical thinking that you're doing behind your treatment to be able to help this person with whatever their goals are? And that's kind of the other piece of this, is talking with the patient to find out what their goals of treatment are. And then how you might use your treatment to help them reach those goals. And what are the different pieces behind that? And then it's just writing it out in a systematic way so that others can read it as well.
You know, ABK, as we're just having this conversation, I'm reminded of many conversations I've had with fellow therapists. And, you know, you sit down and in a social environment or whatever with them, and then you talk about interesting, you know, cases that you've seen and the twists and turns and what happened. In some ways, this is no different than that, but just in a written format.
In a written format, in a very specific manner. So we do have guidelines for people to follow, and what we want to see them to make sure that everything's included. And these are called the CARE guidelines, and that have been adapted for therapeutic massage. With this, there's specific things that we want to make sure that you address in your write-up. Like, we want to make sure that you tell us about the therapist as well. Who is providing the treatment? How much training did they have? What is the environment like where the treatment was given? Are you giving massage therapy in a hospital? Or are you giving it in your treatment room? What does your treatment room, how could that environment maybe influence your outcomes? How often? How often are you treating them? What was the time? You know, we kind of want to know what your protocol was when you were treating them. And then how are you measuring your outcomes?
Absolutely.
Is it simply asking them, are they improving in pain? Are you asking them to track how they're sleeping? Whatever that goal is, how are you tracking what they're wanting to improve upon? So it's just being systematic about it.
Yeah, and that makes it, one, it makes so much sense to have it be somewhat uniform, so we're all having the same playbook. But the other thing is, how frustrating would it be to know, you know, in this case, massage was fabulous for helping this person, and you think, oh, this is great. But then when you read it, they don't describe what they did, and it's like, well, how does that help me as a practitioner? Or if it didn't help, again, what could I do differently? And if you don't know, like, how often and how long, you know, like frequency and duration, well, what if the same treatment would have been much more effective done at a different, you know, frequency or a different duration? The more information I suppose we have, the better we can adjust those criteria.
Right. So the more detailed and methodical you are in writing up exactly what you did, the easier it is for somebody else to do the same thing. So you think about, I love the experiment that my kids get in science class in like 5th grade, where they're told to write out write out how they make a peanut butter sandwich. And then the teacher goes and tries to do what the kids wrote down. And oftentimes there's things like, forgot they didn't put a knife into the peanut butter to get the peanut butter and spread it on the bread. So it's the same sort of thing. If you don't say, pick up the knife, put the knife in the peanut butter, put the peanut butter on the knife, then get the peanut butter and put it on the bread, and then do the same thing with the jelly, and then you have to get the other piece of bread and put it on top. It's the same thing with this. You have to tell us exactly what you did so we know to get the knife to put it in the peanut butter.
I think I might have purchased some furniture they have to put together that had similar directions, actually. So
I've had those too.
Yeah. So you know, I would imagine the more information we have, the better decisions we can make, the more we can learn. And in some ways, that's really what this is about. It's about peer-to-peer sharing of knowledge. Again, if you and I are having that conversation, and I tell you about some interesting, you know, client that I saw, and I did this and that, and this really helped, and I didn't expect it. Now you know that, but you're the only person other than myself who knows that. And that's not really helping the profession, or more importantly, the people who struggle with that condition.
Right. And then the other thing that it can do, these case reports, when people write them up, they can spark the curiosity of researchers. So if you write this up and a researcher, either maybe they have a family member that has the condition, or they have it themselves, or that's just a topic they're interested in, and they go and all of a sudden, let's say they have a little email that pops up that tells them whenever anybody publishes on this condition, they're like, huh, I hadn't thought about massage therapy before helping this condition, whatever it may be. I wonder if I could get funding for that and do my own bigger study. Well, so it can really set things off. And there have been some really famous ones in the past that have really started off research down some interesting roads, and those come from case reports. You want an example?
Sure. Yeah, I'd love one.
AIDS. That's one of the biggest ones. It started from a case report when that started to see, I believe it was the pneumocystic pneumonia, and it started in young men. And that started down the line of understanding that we have to research this more and more and more and figure out what's going on. Started with a case report.
Wow.
They're really important.
Well, you know, what struck me as you were saying that, Anne, is that not only, yes, you know, family members might stumble onto this, the person themselves, researchers might stumble onto this, but so would our allied health, you know, our healthcare colleagues. So maybe there's a physician somewhere who's struggling with just, you know, their primary care. They're, how in the world am I supposed to help this person? What resources might be of use? If they, because the journal has the kind of indexing and the kind of reach that it has, maybe that healthcare provider might discover this, and that might really benefit people as well.
Exactly. And it's just a way to spark those conversations as well. And for, you know, one thing that I'm thinking about as we're still in, at least in my state, we're not opening up completely. We're working on it, but still not there yet. So for those therapists who aren't back yet, or don't know when they're going back, or not sure when they want to go back, if they're needing something to do, they want something to do right now. Even thinking about what patients they've had in the past that might be able to fuel a case report now would be a way to move the profession forward as they're waiting to get back to work.
You know, and I think all of us, anytime you write up something like that, you really do the self-reflection, the self-discovery process.
Right.
It rich in and of itself, that you learn so much from just chronicling your experience with this and thinking it through. It will benefit all of us, but it really benefits the person writing it. And as I understand, any therapist, any practicing therapist has the capacity to write a case report.
Absolutely. Any practicing therapist has the capacity. The advice I kind of give to people who think that they might be doing this, though, is first start by reading them.
Yeah.
Go and read some case reports to see how they've been laid out, what kind of goes into them, so you can start thinking about what you would put into yours.
Mm-hmm.
Especially the ones, I've got to get the date, after 2014, especially in the IJTMB, because that was when the care guidelines came out. So that was when we started, from our journal's perspective, really wanting the case reports to follow this format. So just reading through some of the newer case reports and seeing what is in there and what they look like. And does that really get you moving, thinking through what you would put in yours? They do need to be supported by some of the past scientific literature, what led you to the critical thinking, to how you would use whatever you did to help this person. Why did you pick, let's say, neuromuscular therapy? What was it that led you to that? Or manual lymphatic drainage for something that might not be, particularly called for. You might not, they didn't have any particular edema in any way. Yeah. But you thought, this other stuff I'm doing isn't really working. Let me try this technique that I have in my toolbox.
Yeah.
And it did work. So you would want to tell us why.
I find out sometimes when I'm reading them, I find those reference things really interesting because they lead me down other paths. Like, the case report was pretty interesting, but why did you think of that? And if you got that idea from that article, maybe I should take a look at that article as well, because it might lead me down a different pathway.
Exactly. And what I have found when I was in practice, and actually what led me to go get my doctorate in the first place, was when I was looking at the literature for a certain condition, I couldn't always find it for massage therapy, so that I might find the condition, but not the treatment plan that would help inform me on how to take care of my patients. So let's say there was somebody, again, with narcolepsy. I keep coming back to that one because it's what's sticking in my head right now. So there wasn't any research on how massage therapy could help a patient with this. So what do I go to? So I have to go and look up what the condition is like, what maybe some other people in different allied health professions or in allopathic medicine, how they treat this. Then I have to think through why massage therapy might work.
Yeah. Trying to make that translational thing is not always the easiest thing. It's a little easier when it's like, this is a person who is in my discipline and here's what they did. And honestly, if it worked or didn't work, it's still a learning opportunity. Like, if that didn't work, then let me try something different, because I still have to try to help this person who's sitting in front of me. So
absolutely,
it's really a chance for us to learn and share knowledge together. So,
but also, like you were talking about earlier, with when we were talking about writing down and being precise about the methods. So just because something didn't work in one study or in another case report, doesn't mean that you couldn't try to change the methods in some way and see if it did. So don't let the reading of some other research stop you from trying some new modality or working with a new population.
Got it.
Allow it to spark your thinking. So thinking through, this is what I know about massage therapy. This is what I know that it does from either clinical practice or from the research. So I think that this might work. And so start thinking about how the logic would lead you down to thinking that it would work. And then writing that down and linking it back to that scientific piece that we found before.
It's just what makes this all so rich and so much fun. It's like this endless discovery process, and that endless discovery process makes it's richer for us as therapists, because we're always learning, always growing. And I think for most all of us, that's what we value, is that we are learning and growing every day. But we get to learn and grow every day in the process of helping other people who sometimes come to see us because they are looking for hope and they've struggled in other things. So what a privilege, what an honor to do that. And So it sounds like case reports are a wonderful vehicle to express both of those things.
I think so. I think it's a really great way to start. And I think it's also a great way to get practitioners to contribute when sometimes they feel like they don't as well, or they don't have that avenue as much. I do get contacted by a lot of massage therapists who say they want to get into research. This is actually one way that you can kind of get started. It isn't considered necessarily research by itself, but it can start you on the process of scientific writing, and then moving into that realm of, then you can say, hey, look, I've published this case report. Wouldn't it be great if you had a massage therapist included in your research when you are planning massage therapy research? So it allows you a little bit of credibility as well with others in the scientific and academic community that sometimes, I've heard some massage therapists say that they don't feel that they always get that.
Sure.
But once you get published in a peer-reviewed journal with certain individuals, that gives you a little bit more credibility. You'll always have credibility with me, though.
Yeah. Well, I know several people for whom their case report was kind of the launch pad for many other things that they've done in their career. And so it was an entree into many good things. So, but again, the ideas that we've discussed, shared knowledge and communicating that, and it's a wonderful process. And on behalf of all of us in the profession, thank you for the great work you've done, as editing the journal and really spearheading this. It's a wonderful asset to the profession, and thank you for all that you do.
Well, let me give one last shout out to the other editors there, because I couldn't do it without them.
Yeah,
so
please.
Amanda Basquill, Dr. Basquill is the editor specifically for this section for education and practice. And then Albert Maraska is our research editor. So while I kind of overview everything that comes into the journal, the two of them are the ones that are really managing the process for their individual sections. And they are amazing and brilliant and fantastic to work with. And I couldn't even imagine doing it without either one of them.
They are great. They are great people, as well as everything else, their accomplishments. They're delightful. And so again, thank you to all three of you. And thank you to all of you who are watching this. We hope you enjoyed this episode of Research Perch, and do go to IJTMB.org and explore. Just type in case reports and just see all the things that follow, and then pick a subject that interests you and dive into it, and make this a time of learning and growing. So thank you everyone for watching, and we'll see you soon.
Bye.
If you enjoyed this podcast, please consider donating to the Massage Therapy Foundation so that we can continue to bring you this and many other resources to increase your knowledge and improve your practice. Thank you.